This video provides instructions for how to complete a plan of care from an other provider evaluation. Oftentimes, patients are referred for therapy services after receiving an evaluation from another provider. ACE makes it possible to use the other provider's compliant evaluation to develop the patient's plan of care. Please note that any evaluation received from another provider should be reviewed for compliance prior to using it to develop a plan of care in ACE. Healthcare documentation starts with the evaluation of a patient. Remember, good data in equals good data out. Just like the plan of care for a user develops from their own evaluation, the plan of care is the plan for care. There can only be one plan of care in place at any given time. When you want to change or adjust the plan of care, you must write a new plan of care. The plan of care is a reflection of the thoughtful, clinical recommendation of services needed after communication with the patient, the caregiver, or the family about the needs and treatment plan options following an evaluation and diagnosing a disorder. It also drives authorization requests, therapy service delivery, and it is the benchmark to which the delivery of services is held regarding compliance. It is a legally binding document that reflects your commitment to deliver medically necessary services to your patient, meet the expectations of the physician who has signed the orders for services, and the funding source that will pay for the services. Because of the critical nature of the plan of care for all aspects of clinical service delivery, there are a number of compliance and programming rules built into ACE to prevent accidental non-compliance. Let's take a look at those compliance supports and how to write a plan of care from an other provider evaluation. The plan of care other provider evaluation is initiated from the patient section of ACE. Open the patient record by tapping on the name of the patient. In this example, we're going to complete an other provider plan of care for Mickey Mouse. Before we can document the plan of care, we must first go to the patient EMR and open the other provider evaluation so that we can reference it while documenting the plan of care. Tap on the EMR tab. Narrow the search results by choosing the document type Evaluation and tap the Search button. The search results will open to default in the ACE viewer, but there's an easier way to use two documents in ACE. The clinical user can change the viewer to Local by tapping the radio button. This will open the document using a different application on the user's device, most often Adobe. This is extremely helpful in allowing you to toggle between the ACE plan of care that you are writing and the recent evaluation completed by another provider. By opening the document outside of the ACE program, the user can toggle back and forth, completing ACE documentation forms while also referencing the document as needed. Now the clinical user is ready to document the plan of care other provider evaluation. Return to the documentation tab of the patient record. Tap on the Plan of Care Other Provider Evaluation button. ACE will alert the user that this type of plan of care should only be documented when another provider has completed the evaluation for the patient. The other provider evaluation date defaults to the current date. This calendar is an active calendar, so you can choose the appropriate date of the evaluation on the calendar. The user will adjust the calendar to identify the date indicated on the other provider evaluation. Once the other provider evaluation date is selected on the calendar, the user will tap the Continue button. Enter the medical diagnosis based on the information provided in the other provider evaluation documentation. Examples are autism, Down syndrome, cerebral palsy, and hearing loss. If there is not a medical diagnosis identified for the patient, the user leaves this form blank and taps the Continue button. In this example, let's enter the medical diagnosis of autism and view the clinical diagnosis options ACE provides. On this form, the user will choose the disorder areas identified on the other provider evaluation. Based on the area you choose, ACE will open up diagnoses for each area and will allow the user to write short and long-term treatment goals for each area diagnosed. For example, in order to identify and target language, the user has to click the Language box. In order to identify and target stuttering, the user has to click the Fluency box. In this example, we're going to identify language and articulation and phonology disorder areas by tapping the appropriate boxes and then tapping the Continue button. Since a medical diagnosis was entered for this patient, ACE has crosswalked the medical diagnosis to the following language diagnosis options. For a patient with autism, the appropriate language disorder is coded as R48.8, Language Disorder Symbolic Dysfunction. This diagnosis code is separated into both receptive and expressive components. Check the diagnosis and enter the severity rating, mild, moderate, or severe, for each area using the drop-down box, and enter the onset date. Next, ACE is showing the possible speech diagnosis codes and descriptions based on the medical diagnosis entered for the patient. The clinical user must use the slide scroll to see all options for speech diagnoses. Assigning the appropriate speech diagnosis requires the clinical judgment of the clinician. A patient with a medical diagnosis can still have a developmental articulation delay, and therefore this code is available. Again, use the sidebar to view all possible diagnosis options available for the patient. For patients with a diagnosed hearing loss, use speech and language due to hearing loss code R48.8. Patients with a structural deficit of the oral cavity, such as cleft palate, use the R47.89 speech disturbance code. Choosing the right code is essential in writing a compliant plan of care and submitting billing for services that is clinically accurate. But what if a patient doesn't have a medical diagnosis that caused their speech-language disorder? Simply leave the section blank and the user may click Continue. ACE asks the clinical user to confirm that there is not a medical diagnosis impacting the patient. They may click Yes to continue. The user will next identify the disorder area. In this example, we will choose the areas of language and articulation and phonology and tap Continue. Since there is not a medical diagnosis selected for the patient in this example, ACE is showing the clinical user developmental F codes. F codes indicate that the speech-language disorder is developmental in nature versus being caused by a medical diagnosis. This is a key distinction in coding. The user must identify the expressive and receptive areas of disorder with severity rating and onset date, and then tap Continue. In our example, these are the speech disorder diagnosis options for a patient without a medical diagnosis. Notice that childhood apraxia of speech, R48.2, can occur without a medical diagnosis. When complete, tap Continue. We are going to identify a developmental articulation and phonological disorder, F80.0. Using the drop-down box, choose the severity rating and identify the onset date. Let's keep going by tapping Continue. ACE provides the clinical user with the opportunity to review the clinical diagnosis associated with the patient, and it calculates the overall severity automatically based upon the data provided for each disorder. When the user is satisfied with the clinical diagnoses and related information, tap Yes to continue. The user will next enter the clinical recommendation of services from the other provider evaluation. Again, remember that you can toggle between the evaluation document from the EMR and the ACE Plan of Care Other Provider evaluation. Identify the proficient language of the patient. Now that the primary information derived from the Other Provider evaluation has been entered into ACE, this form begins the actual plan of care for the patient. ACE will auto-populate the current date as the start date of the plan of care. However, this date will change to the date of the clinician's signature because a plan of care is not valid until it is signed. The plan of care start date cannot be a date in the past. The end date will auto-populate 6 months forward from the start date. The clinical user can adjust this date by tapping the blue calendar button. A calendar will appear, allowing the user to adjust the end date to less than a 6-month period, but not more. A plan of care is valid for up to a maximum of 6 months. Here is an example showing that the user changed the end date of the POC to reflect services less than 6 months in duration. ACE will show the clinical user the clinically recommended services from the evaluation. The user will determine if they're going to provide the exact services that were listed as the recommendation in the evaluation, or if they wish to provide services that deviate from that recommendation. In this example, if services are not going to be provided 2 times per week, then the user would tap the No button. ACE then allows the user to enter the actual frequency and duration of services to be provided by means of drop-down boxes. The clinical user will also identify the rationale for the adjusted service delivery plan. Once all information is entered, the clinical user will tap the Continue button. Here is an example where the services to be provided are adjusted from the recommended plan due to following the frequency identified on the patient's IFSP. ACE will show a visual of the clinical diagnosis for each area diagnosed at the top of the form, so that the clinician can determine the area of intervention by tapping the box to the left. If the patient has multiple disorders and areas of intervention, the clinician can choose not to work in a specific area by providing rationale as to why the area will not be addressed in therapy during this plan of care. For areas of intervention to be targeted, the user will tap the text box to enter the long-term goal for the patient. Since this is the initial plan of care, the short-term goal form is blank. To add a short-term goal, tap the Add Goal button. In a subsequent plan of care for this patient, the goals from the last POC will be displayed and addressed by the user. ACE will then display a list of skilled interventions that you can choose to target the patient's short-term goals. ACE does not limit your choice of skilled interventions, but the user should select meaningful and appropriate skilled interventions. ACE will only allow the user to choose skilled interventions that are clinically appropriate for the area of intervention targeted for the patient. In this example, these are language interventions. When you are unfamiliar with a specific skilled intervention, you can tap the blue question mark button to receive more information about the intervention, modalities, and the evidence-based research cited. ACE will then show the user the next clinical diagnosis to identify the area of intervention and long-term goal. Let's keep going. The user will click the Add Goal button to enter the articulation goals for the patient. The clinical user will write short-term goals in the provided text boxes that include the goal, the current level of the goal, and the duration in either weeks or months. To continue adding goals, simply tap the Add Goal button. To remove a goal you have written, tap the Remove button. Again, ACE will display a list of skilled interventions for you to choose to target the patient's articulation and phonology goals. ACE does not limit your choice of skilled interventions, but you should select meaningful and appropriate skilled interventions. If you are unsure of a specific skilled intervention, you can tap the blue question mark button, and ACE will provide a summary of the skilled intervention, the modality, and the evidence-based research provided in the citation. Additionally, these skilled interventions, along with a brief summary and EBR, will print on the plan of care document. There are several frequently used skilled interventions that come pre-selected in ACE. If a clinical user feels that any or all of these skilled interventions will not be used for a specific patient, the interventions can individually be unselected. Additionally, a user may add their own skilled intervention. The clinical user will identify the prognosis towards meeting the short and long-term clinical goals identified on this plan of care. The next form provides the opportunity for the clinical user to provide general comments related to the plan of care, beyond the information that's already been collected in ACE. This form is a free text box where the user can enter any additional pertinent information to the plan of care. Why are you writing the plan of care? Since it's the patient's initial plan of care using another provider's evaluation, it would be relevant and appropriate to explain how the patient was referred to you and how you obtained the written evaluation used to develop this plan of care. Documenting the purpose of the plan of care is helpful to the clinical supervisor during review, but it is also helpful in documenting the clinical story of this patient. Tap Continue. ACE will generate the plan of care document preview based upon what you have entered. This is your opportunity to preview the document carefully to ensure that the information entered is accurate and supports the need for skilled services. Once you are finished with the document and the clinical review requirement is on, you will tap Yes, Submit for review. ACE will alert you that your document has been submitted for clinical review and will be returned to you once the review is completed. Always remember to sync your data so that the mothership receives your documentation, and sync again to get your document back from clinical review. When the review requirement is turned off, you have the choice to submit for review or sign the POC without review. When you tap Sign POC without review, the attestation and signature form will open. Note that the attestation and signature on the form is the clinical user's commitment to the legally binding document that is the plan of care. Your signature on the plan of care attests that the plan of care is a valid representation of the skilled services needed to remediate a diagnosed disorder. The goals are clinically appropriate and necessary for functional communication or swallowing. Recommended services will be delivered using skilled clinical intervention approaches that are well documented in evidence-based research, and that the recommended POC is clinically appropriate, medically necessary, and requires the skilled intervention of a licensed speech-language pathologist. When you are satisfied that all statements are true regarding the plan of care you have just written, tap the Yes, Sign Plan of Care button. The password box will appear. You may add your signature to the document by entering your password. The password is the same as the ACE login password. ACE will provide you with a confirmation message that the document has been signed and filed in the patient's EMR. From that moment forward, this plan of care is in place, and any former plans of care for the patient are invalid. To change goals, discontinue goals, mark goals as met, change the frequency, or any other specific detail noted on the plan of care, a new plan of care must be written. This concludes the plan of care other provider evaluation of ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written clinical ACE manual for detailed instructions and screenshots related to specific features and tasks.